In your most recent book, you talk about supplements. What are some of the key points that people should get out of that? Because it can be kind of overwhelming with all of the products that are out there.
Absolutely right. Absolutely correct. Well, obviously, you know what's going on in this field, right? The very first thing where we want to focus is on the general vitamins and minerals. Okay. And again, Professor Emanuel Churaskin, Alabama University School of Medicine, who defined lifelong health as a state of homeostasis by doing so many things correctly, he looked at vitamin intakes. And guess what? When he uses the Cornell Medical Index questionnaire, they find for optimum functioning in respect to vitamin A is, for example, 4 to 6 times the RDA. In respect to B vitamins is 4 to 6 times the RDA. So in respect to minerals, most people are getting a reasonable amount, but not enough. So with the vitamins, you need a multiple of them in order for optimum health. With the minerals, you just need a little bit more. But nobody, literally nobody gets even the RDA of vitamin minerals from the diet alone, right? So you need the supplements. That's the first level. The second level up is to look at inflammation, right? I mean, every disease has its onset with inflammation, right? I mean, it's even in a normal bodily function. We touched on to earlier, sexual function, flossing your teeth. Well, what does that have to do with that? Well, very simply because it causes inflammation. It is transmitted into the body. So you want to focus on, for example, fish oil, turmeric, or the actual ingredient from the turmeric, curcumin, alpha-lipoic acid, and there's a whole bunch of new ones that are constantly being evaluated and so on. You know, get a good vitamin company and have them send the catalog, and you know, and you'll read about it. Anyway, so you have the basics, you have the anti-inflammatory, and then the next step up is for mitochondrial functioning. In your body, in your cells, you have the cell wall, then you have the nucleus, and in the cytoplasm of the cell, you have mitochondria. Those are the energy production factories. And the energy production factories, again, they are relying in their capacity on some very specific supplements, right? Again, alpha-lipoic acid, coenzyme Q10. I mean, you can list the whole thing on that. And so those are the 3 major levels, you know, that people should pay attention to, right? Okay. That's just the basic stuff. And then we go into special area, like, for example, heart disease, cancer, you name it. A very interesting thing was very recently with Parkinson's. They found that Parkinson's, in the cell membrane of the nerve cells, you have a phospholipid, right? Okay. And it's actually known as PC, phosphatidylcholine, right? And you can buy it as a supplement. And normally that is somewhat affected by the digestion process. So you have to take a little bit more, but it's totally natural, no problem. And some doctors even have developed a intravenous phosphatidylcholine formula. And as well, about 2 weeks ago, I talked to several doctors who are using it. When they use the intravenous together with the oral, they say in some Parkinson's patients a reduction of 60 to 70% in the shaking. Right? Wow. It's very impressive. Earlier we mentioned, for example, what do you mean? Pomegranate, right? Pomegranate. When a doctor measures PSA in a man as you get older, and if the PSA increases, prostate-specific antigen, right, PSA, he tries to evaluate how long it takes for that PSA to double. And if it doubles relatively fast, which is normally 12 months, that's trouble. Maybe needed surgery, etc., etc. However, if you give people pomegranate, either the concentrate or, you know, tablets or whatever, or the regular pomegranate juice, whatever, twice a day, the doubling of the PSA takes as long as 57 months. I mean, so long that it becomes unimportant because you're going to be dead from something else by the time it reaches that level, right? There's so many different areas with very specific things, right? Like in my heart recovery, we took it the basics, right? A4M. I mean, the people at A4M, leading people, I could name one of them after another, who always told me, say, Hans, think outside the box, right? Inside the box is medicine, forget it. Outside the box is nutrient, aggressive thinking along those lines, right?